Our next speaker is going to be Dr. Shyamala Subramanian. She's going to be presenting on the evaluation of a radiation oncology microclerkship as a component of a medical student training.
Okay. Good morning, everyone. My name is Shyamala Subramanian, and I'm a third-year medical student at Rutgers, New Jersey Medical School. And on behalf of our research team, I would like to present to you our project titled An Evaluation of a Radiation Oncology Microclerkship as a Component of Medical Student Training. So throughout their clinical years, many medical students are offered exposure to oncology subspecialties, including medical oncology and surgical oncology as a facet of their internal medicine or surgical clerkships. However, exposure to radiation oncology lacks such a similar natural pathway during the clerkship years for many medical students. And in addition, most students don't get lectures from radiation oncologists during their preclinical years. So many medical students graduate from medical school with no prior exposure to radiation oncology, and as a result of that, they lack a complete understanding of interdisciplinary cancer care, specifically as it relates to the role of radiation oncology or radiation therapy. So our goal in this study was to create new pathways to increase medical student exposure to RADonc and to broaden students' understanding of interdisciplinary care. So considering that many medical students get zero exposure to RADonc currently, even spending one day to learn about radiation oncology would represent a dramatic improvement in their understanding of the specialty. So the hypothesis of this study is that incorporating a one-day microclerkship in RADonc as part of related clerkships will be feasible and perceived as valuable to participating medical students. This initiative was conducted at a single institution where the radiation oncology clerkship director coordinated with the clerkship directors of medical oncology, radiology, and palliative care clerkships to arrange for every third and fourth year medical student rotating in those specialties to also spend one day in radiation oncology, which we termed a microclerkship. So prior to their microclerkships, students were given educational material to review, which came from the astro.org medical student section. These educational materials included a 30-minute introductory recorded presentation about general RADonc principles and a companion slide deck which described how radiation therapy is relevant to patient care as it relates to the primary subspecialty that they were rotating in. So the day included shadowing a radiation oncologist attending physician, as well as any resident who was working with them, and observing patient treatments with the radiation therapists. And depending on the day's events, the day may have also included attending tumor boards, brachytherapy procedures, or treatment planning sessions. And immediately after their experience, students were invited to complete an anonymous electronic survey of multiple choice questions and Likert scale type questions to get feedback on their experience. So pilot data from 15 students is reported here, and it captures a time period between November 2020 and February 2022. It was approximately one student per month for about 15 months. This included 3 third-year students and 12 fourth-year students. The gender distribution of students was 7 females and 8 males. And as far as participating specialties go, there were 4 students who completed the microclerkship during medical oncology clerkships, 4 from radiology, and 7 during palliative care. None of the students had visited a radiation oncology department previously, and only one had attended a prior lecture from a radiation oncologist. These 3 charts display data from student responses. On the far left of the screen, we asked, was this day in radiation oncology a valuable experience for you? With responses ranging from extremely, quite, moderately, slightly, and not at all more valuable. And all students answered that the day was more valuable. 4 students, shown in purple, found it to be extremely valuable. 9 in blue said that it was quite valuable. And 2 students, shown in green, said that it was moderately more valuable. And notably, 0 students reported answers of slightly valuable or not at all valuable. The middle chart displays the answer to the question, do you feel more knowledgeable about the role of radiation therapy in cancer management after this shadowing experience? And 14 out of 15 students said yes, shown in blue, and 1 student said maybe, in purple. Notably, again, 0 students reported no gain in knowledge from the experience. And the chart on the far right of the screen assessed, has your interest in doing a longer 2 to 4 week rotation in radiation oncology changed after this experience? 1 student reported much more interest in blue. 7 students said that they had somewhat more interest in green. 4 students reported about the same level of interest in yellow, and 1 student reported somewhat less interest in red. 0 students reported much less interest. So based on the data from this study, we can conclude that there is a valuable role of incorporating radiation oncology exposure into medical student clerkships in related specialties, as students reported a valuable experience from the microclerkship, as well as a gain in knowledge and an increased interest in a full rotation in radiation oncology. At present, we are looking to expand student participation into other clerkships in addition to the ones that were currently involved. And we also hope to expand to multiple institutions across the country in order to continue to drive student understanding of and interest in radiation oncology. Thank you so much. And if anyone has any questions, I would be happy to answer them.